Hi, I'm Dr. Fred Echols, Acting Director of Health for the City of St. Louis. The Department of Health continues to receive numerous questions related to COVID-19 from St. Louis residents. This week, we answer your questions about our youngest neighbors. Andrew in zip code 63113 asks, I'm seeing the COVID-19 vaccine being administered. Can my child receive it? That is a great question. We encourage all children to be vaccinated against diseases. However, at this time, the COVID-19 vaccines are not authorized for children. The earliest clinical trials focused on the adult population. We are just now starting to see clinical trials for adolescents. As more information becomes available, the City of St. Louis Department of Health will update the COVID-19 vaccines website at stlouis-mo.gov/COVID-19. Regina in zip code 63147 asks, how can I protect my child if the vaccine is not yet available for them? The best way to protect them is to follow prevention measures both inside and out of your home. These include limiting the number of people your child comes into contact with, including loved ones. Contact tracing shows private gatherings are contributing to the spread of COVID-19. If someone visits who does not live with you, please ask them to wear a face covering and social distance. Also, practice good hygiene by washing your hands often and reminding your children to do the same. Teach your children fun techniques like singing a song while scrubbing, and dry their hands thoroughly when done. It's important to watch your child for any signs and symptoms of COVID-19. If you have any concerns about symptoms your child is showing, please contact your child's primary medical provider. Some children who contracted COVID-19 or were near a COVID-positive person develop multi-system inflammatory syndrome. This syndrome is rare but can be deadly. If your child experiences signs of an emergency, call 911 or visit an emergency room. Jennifer in zip code 63116 asks, some students will start back in school next week after the holidays. Is it safe for them to return? That's another great question. Schools in the City of St. Louis are taking steps to protect not only the students, but the staff's health. The City of St. Louis Department of Health worked with public, charter, independent, and archdiocesan schools at the start of the school year to develop guidance implementing evidence-based protocols to protect the health of students, staff, and the community. The Health Department continues to support schools in the City of St. Louis to ensure they are able to maintain safe environments for staff and children. The best thing parents can do is keep your student home if they show any signs and symptoms of COVID-19, which include having a sore throat, runny nose, new loss of taste or smell, diarrhea, nausea, vomiting, or cough, and fever. If your student is asked by the school or health department to isolate or quarantine, please keep them home and away from school and extracurricular activities. Please see guidelines for isolation and quarantine on the health department's website at stlouis-mo.gov/COVID-19. Jacob in zip code 63139 asks, what else can parents do to protect their children? Parents should always consider their own actions outside of the home to avoid bringing COVID-19 back with them. Be sure to practice social distancing and wear a facial covering when outside of your home. You should be the best advocate for your child's health. Tammie in zip code 63101 asks, I'm starting to see camps announced for the summer of 2021. How will I know if it's safe to sign my child up? While we continue to see more COVID-19 cases in the City of St. Louis, there is hope on the horizon. The first doses of the COVID-19 vaccines are being administered to frontline workers. Also, because of the amazing work schools in the City of St. Louis did in the fall semester, the proportion of positive cases in City of St. Louis school-aged children is only 5.6% of the total cases. Organizations wishing to hold summer camps should review their infectious disease control plans as they begin to think about summer camp activities. They should also submit the plan to the Health Department for review and approval. To submit the plan, please email the document in Word format to health@stlouis-mo.gov. I want to thank everyone who sent questions and all of you for tuning in. We aim to protect the health of all residents, especially youth and children. Be sure to tune in next week for more critical public health information. I want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well.